Thanks, Amanda.
Bonjour tout le monde. Before I get started, I want to take a moment to recognize Canadians who are doing some of the toughest jobs in the country. The women and men working in our hospitals, our seniors' homes, and our long-term care facilities are making sacrifices every day. If you do one of these jobs, thank you. Thank you for keeping us safe and healthy and protecting our loved ones. You deserve our full support. So if you need a hand getting through these tough times, we'll be there for you. Today, we're announcing more help for more Canadians. This includes topping up the pay of essential workers. At the same time, we'll also be expanding the Canada Emergency Response Benefit to reach people who are earning some income, as well as for seasonal workers who are facing no jobs, and for those who've run out of EI recently. And a little later, I'll have some news about where we are with testing. Au Parlement, vous m'avez entendu parler des
In Parliament, you've heard me speak about the contribution of the largest generation, the one who grew up during the Great Depression and fought during the Second World War. Today, across the country, the last members of this generation are living in elderly houses and long-term care centers. The tragic and disturbing reality is that in those places are particularly vulnerable to COVID-19. This is a topic that I will talk about in our discussion with the premiers tomorrow night. We must all do better. We must all show leadership to support the elders that have built that country. To start with, our government will start with the provinces and territories to meet the salaries of the essential workers who are earning less than $2,500 per month, like those of the long-term care centers.
Contributions of the greatest generation who grew up during the Depression and fought through the Second World War. Today, across the country, the last members of this generation live in nursing homes and long-term care facilities. The uncomfortable and tragic truth is that the very places that care for our elderly are the most vulnerable to COVID-19. I will be addressing this with premiers tomorrow night. We all need to do better. We all need to take leadership for the seniors who've built this country. Our government will work with the provinces and territories to boost wages for essential workers who are making under $2,500 a month, like those in our long-term care facilities. For many workers looking after the most vulnerable Canadians, including seniors and those with disabilities, we know conditions have gotten more difficult over the past weeks, and you need support right now. Tomorrow, in our weekly meeting, I will discuss with provincial and territorial leaders the importance of getting this wage boost in place as quickly as possible. As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time. En mars, in
March, our government has installed the Canadian Emergency Response Benefit. This measure is part of a plan that we've put in place to make sure that everyone would get the necessary help to get through these difficult times. Now, millions of people have already got the benefit, but we know that many people are not eligible and they still need help. So today, we will have more flexibility on the admissibility criteria to enable more people to benefit from this. If you are earning $1,000 per month or less, you can now receive the Canadian Emergency Response Benefit, since many people do not work as many hours as before and others must adapt to the working realities as freelancers or contract workers. Those who have used all their EI benefits recently can also get the benefit. And across the country, many will not have seasonal work this summer because of COVID-19, so this Canadian Emergency Response Benefit will be there for them also. It's also a difficult context for artists and creators across the country. Cultural places are closed, and work is not as many. Minister Guilbeault has heard the artists that those who didn't work before the COVID-19 are not included will now be included into this emergency response benefit. The artists in those tough times continue to help us dream and reflect, put sun in our daily light, and we will always be thankful for them.
I can announce that we are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out. Maybe you're a volunteer firefighter or a contractor who can pick up some shifts, or you have a part-time job in a grocery store. Even if you're still working or if you want to start working again, you probably need help in making ends meet. So if you earn $1,000 or less a month, you'll now be able to apply for the CERB. If you were expecting a seasonal job that isn't coming because of COVID-19, you'll now be able to apply. And if you've run out of EI since January 1st, you can now apply for the CERB as well. And for others who still need help, including post-secondary students and businesses worried about commercial rent, we'll have more to say to you very soon. No matter who you are or where you live, we're in your corner. After
accepting a first request for help for the digital aspect to the Canadian Armed Force, we have asked for Nunavik. We're now sending to the lower Côte-Nord area of Quebec, and Canadian Rangers will be heading to that region.
Nunavik, the government of Quebec has sent us a second request for Basse-Côte-Nord. I can confirm that the Canadian Rangers will be there to provide support. I want to thank our women and men in uniform and the families who serve alongside them for all that they do. Whenever we need you most, you're always there for us. Par moment, on peut se sentir.
At times, we can feel overwhelmed by the events. We are in a situation that can seem surrealist, and we might not understand everything that happens around us. And this week, the government is launching a portal a web portal that will have all the mental health resources available to Canadians. You can go to Canada.ca or use the app Canada COVID-19 to speak with someone. There's no shame to feel like this. The important thing is to get help when necessary.
Know that you aren't alone. And there are people who can help. We have launched a mental health portal at Canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other. Finally, we have more news today to share on testing. Lumen Ultra from New Brunswick, with whom we signed a contract, is now ramping up production to supply enough COVID-19 test chemicals to meet the weekly demand in all provinces. And in the last few days, we received a new batch of swabs to make sure every province has the supplies they need to keep testing. Whether it's reagents or test kits, we are ensuring that Canada has the tools to fight this virus. Tomorrow, I'll also be speaking with the other G7 leaders about continuing to coordinate a strong and effective global response to this pandemic. L'entreprise Lumen Ultra.
The Lumen Ultra business company in New Brunswick is increasing its production capacity in order to offer enough chemical products to do COVID-19 tests that we need to do every week across the country. And in the last few days, we have received more equivalent for all provinces. I know that everyone wants to know when life will get back to normal. And the reality is that we cannot give you a precise date. But here is what we know. For this to end, we need to stay home. We need to limit our comings and goings as much as possible and keep a distance, a 2-meter distance with others. And if everyone does its part, we will get through this together. Thank you.
Thank you, Prime Minister. We'll now go to the phone for questions. There'll be one question and one follow-up. Operator.
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelle, à vous.
Bonjour, Monsieur Trudeau. J'aimerais vous entendre.
Mr. Trudeau, I'd like to hear you on the discussions that are going on with Quebec on possible coming of the armed force in the long-term care centers, and the members of the medical division have been told that to be ready, but are they ready to go? We are in a constant discussion with Quebec and other provinces in order to see how we can help even more. We have put in place a portal where people who have experience, medical experience, or specialized experience can offer their services, and we have shared this portal with all provinces. Now we continue to work directly with Quebec on their request to have more resources, and we will continue to work with Quebec on this. You're not answering my question. I understand that you work, but we know already that there has been discussion. Quebec has said yesterday we need arms on the field now. Why isn't there anything happening now? Beyond the medical personnel, can we send military personnel to serve food, pick up trash? What can you do right now? We are immediately talking with Quebec, with the province of Quebec, to see how we can help. We recognize that there are some needs in Quebec and across the country, and that's why we are working with the provinces to give them, if possible, the resources that they need. We are there to be partners. We are there to continue those discussions and bring help as shortly as possible if necessary.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Oui, bonjour, Monsieur Trudeau. J'aimerais que vous me disiez ce que vous pensez de la.
I'd like you to tell me what you think about the Americans' decision to freeze the funding to the WHO. My priority, and the priority of my government now, is to do everything we can to protect Canadians and to ensure the health and security of people across the country, and this implies to work with experts here in Canada and across the world. So we continue to do this job, this important job for Canadians.
One of the things that is so important for Canada to do is to continue to work with local experts and international experts to do everything we can to fight this virus and keep Canadians safe and protected. That's what we will continue to do.
I understand what you're saying, but don't you worry that it will have consequences, Mr. Trudeau, on the fight, the global fight against this pandemic of COVID-19. Listen, I will have the opportunity tomorrow to speak with other leaders of the G7 to discuss about how we will make sure to coordinate properly and to continue to work with all our efforts to counter this COVID-19 and to coordinate our approach based on science and working with experts across the world.
Merci. Prochaine question.
Thank you. Merci. The next question, Justin Ling, Freelance. Please go ahead.
Hi there, Prime Minister. Obviously, I've been asking you for about a month now about the state of Canada's prisons. You've promised repeatedly that new measures would be coming, that the Minister of Public Safety would be announcing new cooperation with the Parole Board. We still haven't seen any of that. So is this just not a priority? Is nothing coming? Is there even going to be a decision about those inmates who are being released on day passes, like other provinces have done, to release them temporarily? Is there any announcement coming?
We have made significant efforts and taken significant steps to ensure that our incarcerated population is kept as safe as possible from COVID-19. There are a number of measures that we've taken. We continue to look at more measures. We're coordinating with the provinces on these efforts as well. We know that this is an area where we've seen challenges in terms of outbreaks, but we also are continuing to step up our efforts every day to ensure that all Canadians are protected.
So you say you're stepping up your efforts. The directive from the commissioner last week said that corrections officers should wear face masks. The Corrections Canada has previously said they're providing soap and hand sanitizer. By all accounts, those things aren't happening. So if the work you're doing isn't happening, do you need to change tack? And finally, have you totally abandoned the idea of releasing federal inmates?
There have been a number of discussions at the highest levels about various processes that need to be put in place. There have been a reduction in transfers, in issues that have put potentially people who work there and people who are incarcerated there more at risk. We have taken a number of measures. We will continue to look at taking more measures, and we will ensure that the measures in place are properly followed.
We recognize how it's important to ensure our protection of all those working and those who are incarcerated in our federal institutions, and that's why we've put some specific measures. We will continue to make sure that those measures to be followed, and we will always look at new ways to ensure the protection of those people.
Merci. One more question on the phone, operator.
Thank you. Merci. Next question, Jim Bronskill, Canadian Press. Please go ahead.
Good morning, Prime Minister. Social distancing advice differs from jurisdiction to jurisdiction, from Vancouver closing Stanley Park to cars, so more people can walk around it, to Ottawa's local experts telling people to basically not chat on their driveway with neighbors. In light of this, how do you sustain public confidence in social distancing measures?
I think we've been very, very clear that the best way to prevent further spread of COVID-19 is to stay home as much as possible. If you have to go out infrequently and keep 2 meters distance from each other and wash your hands aggressively and often. These are the things that we're asking all Canadians to do. Across the country, we recognize that different communities are in different situations, that there are different local health experts giving advice that is suitable to that particular context. We make sure that everyone is getting the message that we all have to do our part to fight COVID-19, and that means engaging in social distancing, but it is perfectly normal that there be slight variances in approaches in a pandemic that is manifesting itself in very different ways in different parts of the country. Okay.
We underline now it's important to take measures to protect ourselves and keep COVID-19 from spreading even more. It means that to stay home as much as possible and to not go outside unless you really have to, and then if you have to, then keep 2 meter distance with others, wash your hands regularly and aggressively. Now, in different regions of the country, there are different situations on the pandemic. There are some little variations in the recommendations from local experts, but the great recommendation remains to do everything we can to keep social distancing and to make sure that we stop the expansion of COVID-19.
On the World Health Organization, how much total financial support is Canada now providing to the organization? And has the U.S. president ever put any pressure on Canada to either boost or, of late, reduce its support for the organization?
Canada's support for the World Health Organization is in the tens of millions of dollars. I think we've increased it recently, but I can make sure that someone has the exact numbers for you or for the media. No, the President hasn't made any direct asks or indirect asks of Canada around that.
Français.
Okay. Je crois que
I believe that
on appuie,
we are supporting the WHO to the level of tens of millions of dollars per year. Now, I know we have increased recently our contribution following the start of this pandemic, but I will make sure that you have a more precise response or answer in the hours coming. Now, no, and to the other question, that President Trump hasn't asked to Canada anything regarding the WHO.
l'OMS. Merci.
Glenn McGregor, TTV News. Prime Minister, you've repeatedly said how much Canada has relied on WHO for information about what's happening around the world. Are you satisfied the organization sufficiently interrogated the information coming out of China in the early days of the pandemic? We know now a lot of the information was either false or misleading, especially about human-to-human transmission. Do you think they did a good job on how they handled that information and shared it with other countries?
I think what we need to remember is the path through this pandemic is for us to base ourselves on science, on the recommendations of experts, on the data and the knowledge that we've gathered from past pandemics and past health issues to apply to these situations. And that's why we will always continue to work with experts, both domestically and internationally, to take the best advice possible in keeping Canadians safe. Of course, in the coming months and years, there will be many reflections on various institutions and systems, both domestically and internationally, on how we can improve our response, how we can learn from things we could have done better in this process. These are things that will come in the coming times. Right now, our focus needs to be on doing the best we can right now to protect Canadians.
We're hearing about potential shortages of medication used for pain-killing and sedation before patients are intubated and put on ventilators. What's happening at the federal level to ensure that there's a continued supply of those medications?
Public Health Canada and Procurement Canada are working together to ensure the steady supply of essential medications to Canada, both related to COVID-19 and not. We recognize that this is a global health crisis, so there are challenges, but Canada has a very strong pharmaceutical industry. We have very strong relationships around the world on getting medication and necessary supplies, and we will continue to do everything we can to ensure that Canadians get what they need. Nous avons nos équipes et ministères.
Our teams and our departments have been working with provinces and our partners across the world to make sure of the availability of medication and essential goods. We will always do what we need to do to ensure that Canadians have the necessary products. We acknowledge we're in a World Health crisis, but Canada will always have the necessary equipment to help Canadians.
Tom Perry, CBC News. On the WHO, you were just asked this, but the Conservatives and others have raised concerns that the WHO was too willing to take the word of the Chinese regime early on in the pandemic. Do you share those concerns?
I think there's obviously reflections that we have to have going forward, and we have to make sure that we are doing everything we can to keep Canadians safe. And that is our focus right now. What can we do now? What do we need to do in the coming weeks? How do we lean on experts in international institutions and in partner countries around the world who are making recommendations alongside our domestic experts on what we need to do now? There will be plenty of time as we move forward to reflect on challenges that were faced in the past. We need to learn and move forward as quickly as we can.
And you said yesterday that you're talking to the provinces and territories about eventually reopening the economy. Can you say what work specifically you're doing with the provinces and territories to do this? And you also said that there are different points along the spectrum of the pandemic. So do you see when things do start returning to normal, is that going to be on a provincial level, a local level, a national level? How's it going to work?
Well, we recognize that this pandemic is going through very different phases at different points, different places across the country. One size fits all will not work for a country as diverse as Canada, but the overarching principles are extremely important. We know, regardless of where you are in the country, we need to get through this first wave before we can start releasing some of the rules around social distancing and staying at home. How that release works will vary from region to region, from industry to industry, and coordination at the federal level on how we do that is going to be very important. But with spring coming, people are looking outside, wanting to get out, wanting this to be over. I understand that. It will be weeks more before we can seriously consider loosening the restrictions. It would be terrible if we were to release restrictions too early and find out that we're suddenly back in another big wave of COVID-19 and everything we've gone through up to now would have been for nothing, because we'll find ourselves once again in the same situation. If we hold on through this period now, as long as we have to, once we are able to release things, we will be able to better control how things move forward. But as impatient as people are getting all across the country, we need to continue to hold on if what we're doing now as sacrifices are going to be worth it. Okay.
I recognize how much people want to know when will we be done with this? When can we have more flexibility on social distancing rules, and how to when will we relaunch our economy? The reality is that if we relax our rules too quickly, we can end up too easily in a situation where we're currently in, or even worse, with another wave coming almost immediately. In this case, everything we're doing right now would be for nothing. People are currently making sacrifices, are going through extremely tough times. We must continue to do this for many weeks in order for us to be ready to manage vigilantly and attentively a gradual exit of this. We will have to coordinate this with provinces, but furthermore, we will have to stay in the current phase for a while to make sure that when we will release things, we won't end up being in the same situation a few months later.
Prime Minister Janet Silver, Global News. I know you've just spoken about a coordinated effort and some more patience needed in terms of reopening the economy. But just to follow up on that, I'm wondering whether you envision when that happens that workers will be tested before they return to work.
Obviously, when we are able to loosen the controls on social distancing and start to reopen our economy, massive, rapid testing on a very wide-scale basis will be an essential part of the vigilance we have to have. There will also be a need for very aggressive contact tracing whenever there is a case that appears. We are going to have to be extremely quick about responding to any future outbreaks in future waves. But in order to get to that point, we need to continue doing what we are doing now for many more weeks. We cannot be in a rush to get things going again, because if we move too quickly to loosen all these controls, everything we're doing now might have been for nothing. We'll find ourselves in another peak just as bad as this one or worse, and it will be extremely damaging both to how Canadians feel, but also to our economy. That's why we are going to be extremely careful about any steps towards reopening the economy. It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on still. And then, once we're ready, once we feel we're through, once the experts are telling us that we can talk about reopening the economy a little bit, we will take very careful steps and do that. Okay. Je reconnais que depuis plusieurs jours,
I recognize that for many days now, many people are talking about relaunching the economy, to relaunch our and it's exciting to hear people here about going out of their home and get back to some normalcy. We're not there, and we're far from there. If we reopen too quickly, we could easily end up in a situation that is worse than what we are in now, and everything we did for many weeks would have been for nothing. And all this will be we will have to restart again. And we don't want to experience this, so be patient, continue this wonderful discipline that we are all demonstrating as Canadians, to be there one for the other, to protect our health workers and to do everything to protect our elders, and we will get through this. We need to continue to hold on.
Prime Minister, as we see the horrific stories unfold each day across the country with regards to long-term care facilities, people getting sick, people being abandoned, many dying, if your mom was in one of these facilities, what would you do?
I can't imagine what so many Canadians are going through right now with loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days. Nous reconnaissons à quel point c'est essentiel.
We acknowledge that it's essential to be there for our elders, to be there for those who are working at very modest salary, with very modest salaries, to help our elders. Oh, we must continue to be there for them, and that's what I will discuss on with the premiers tomorrow, how we can support those working with our elders and also support our elders to make sure that we keep them healthy and safe. They are experiencing extremely difficult times of anxiety, of fear, and uncertainty. If they will be able to see their kids, their grandkids, these are extremely difficult times, and as a society, we must do better for them. On the CHSLD, the long-term care centers, the Army can possibly intervene. Will you concretely send them, especially the medical personnel, or you're thinking about sending other Army Corps or other personnel of the armed force, other functions, to help those who are overwhelmed and underpaid? We're discussing with the province of Quebec and other provinces to see how we can send more resources. As we said, we had 2 specific requests from Quebec to send the Army in Nunavik and in Lower Côte-Nord area, and we will continue to work with the province. We will respond to any request made on anything, and we are there to help, to work with provinces and as they see good.
There have been 2 requests so far by Quebec to send in support from the Canadian Armed Forces in both Nunavik in northern Quebec and in Basse-Côte-Nord. These are things that we are doing. As any more requests come in, we will look to support Quebec or other provinces who are asking for help from the federal government, regardless of what that help looks like and what they're asking us. We will be there to help out as provinces need help.
Sur la pandémie comme telle, vous dites qu'il faut continuer de faire
On the
ça.
pandemic itself, you said we need to stop this. But what we're doing is to slow the propagation. We won't be stopping anything before a collective immunization or a vaccine. Are there any scenarios on the collective immunization to get certain sectors back to work in order to see this immunization in action and to protect other people like other countries are doing? The big danger is to see our health sector being overwhelmed, and we could move from a death rate of 2-3% to 10-15% like we've seen in other countries. That is what we absolutely want to limit. Now, we are slowing the propagation right now of COVID-19, and we are also developing methods and capacities technically by screening tests, with technology, with capacity to follow the contacts and make sure that we know who could be infected from one point in time or a certain point in place. We are developing tools in order to be able to be vigilant enough once we have gone through this first wave of COVID-19 in order to untighten a bit on things on the economy and on citizens. We acknowledge that until there's no vaccine, we will continue and we will have to continue to be extremely vigilant, to act extremely quickly if there's some kind of a surge of COVID-19, and those reflections, those thoughts are what we are discussing about. As I said, we will need to stay in this current phase of restriction that is pretty severe in order to get the capacity through time and see this first wave slow down enough to look at the next stages.
We know that until there is a vaccine for COVID-19, we are going to have to remain extremely vigilant as a world, as a country, to resurgences, even once this first wave is through. Once we see this first wave pass through Canada without having overwhelmed our healthcare system and our healthcare workers, as we certainly hope, we will be able to look very carefully at how, with extraordinary vigilance and very rapid response times to any future resurgences of the virus, we can carefully re-engage in certain sectors of our economy in loosening up the restrictions. But we are not there yet. We have to be through this first wave sufficiently to be able to know that we have the capacity to stamp out and restrict any future outbreaks as they come along. That means technology, that means better testing capacities, that means continued vigilance, not just by governments, but by all Canadians to preventing it. We're still a number of weeks away from that, but we are reflecting on what that looks like and what sort of technology and medical solutions will be necessary. We will get through this together, but for now, we need to stay strong in our social distancing measures and by staying at home. Merci beaucoup tout le monde.